Thanks for everyone coming today. We wanted to give you a nice presentation on traumatic brain injuries. A lot of the most common ones we see in the community, kind of lay the groundwork of what exactly is it, what all is entailed in that, and how do we get you, number one, to recognize it, number two, treat it. And we've got great facilities here at CCMH to recognize those things. We've got great therapists and athletic trainers out in the community. So one disclaimer on my part, my wife would not let my 9-year-old stay up past 9 to help me do my slideshow. I am technologically disadvantaged.
I understand that.
Yeah. So we see brain injuries quite a bit in the emergency room. Most people, think of brain injuries as, the major car accidents or, falls off of, buildings or scaffolding. But in all honesty, brain injuries happen, we call them traumatic brain injuries. But they don't all have to be dramatic. That's what everyone thinks and comes to mind when they hear the word traumatic brain injury. They can come under the radar, and a lot of times it takes a good health professional to recognize that you had a brain injury and what you can do about it. And then how do you get the person back on the road to recovery, get them the appropriate interventions they need, get them the therapy services they need to get them functioning at a high level. So a lot of the brain injuries happen from ground level falls. Our number one injury that we see in the emergency room comes from falls. And that's what leads to disability, especially the older we get, they come from ground level falls. And then you throw in the complications with, other health conditions that we all have to treat. Some people have to be on an aspirin a day. Some people have to be on blood thinners. There's not just, the old warfarin, but we got new novel anticoagulants. We call them NOACs, and those help for hearts that are out of rhythm, people that are prone to having blood clots, whether they're deep venous thrombosis, blood clot in your leg, people that suffer blood clots in their lung from, cardiovascular issues have to be on, blood thinners. And so we're always on high alert when someone comes into the emergency room and says, well, I tripped and fell and I bummed up my shoulder and I whacked my head and I had a little bit of change of vision. I got this ongoing headache. Those are cues that we pay attention to make sure that they are thoroughly checked out from a medical and neurological standpoint, because those can be devastating. Anyone need a new Medicare supplement? So medications are a big one, ground level falls. The other one that happens come from traumas is from car accidents, motor vehicle accidents, and sports injuries. We see a lot of head injuries from sports injuries, and you can about imagine kids going at full speed, high velocity, hitting each other, football, soccer, basketball. So a lot of moving parts, and the head being one. And so I was, when people try to downplay traumatic brain injuries, I always give them the analogy, your head is in a confined space and it is in a confined container. And that container has a little bit of fluid in it, and then this big lump of tissue we call the brain. Some people have more than others, but it is a confined space. So you can imagine the faster someone's moving and you come to an abrupt stop, that in itself can create a brain injury, because the brain, if the body's locked into like a seatbelt, sometimes you don't have to hit anything. It's just the high velocity and slowing down dramatically can send the brain against the skull, and you can have reflex or whiplash back. And sometimes the more birthdays we collect, the older we get, those tissues aren't as resilient, and you can shear off little arteries, and you can have bleeding. So same applies to when someone's walking, tripping, slipping on a rug, and you fall down and your head hits the ground. You're like, well, I don't have a cut. I really don't have much bleeding outside. That is one indication. But the second indication is, how do you feel? Did it make you very sick to your stomach? Did you get nauseous? Did you have double vision? Do you have a hard time concentrating, thinking? Those are all signs that that brain had to come, it had to come to an abrupt stop, and that's the inside of your skull. So there's a lot of force inside there that can create injury to the brain, and those all need to be evaluated. These knowledgeable ladies will go into more of the treatment afterwards. What is the treatment? A lot of it really comes down to time. And the non-injurious brain, or the brain that's just been injured but no blood vessels have been severed, it really comes down to time. You know, if you injured, the same stands reason if you injure your knee, shoulder, your wrist, and you're sore, and do what your mom tells you. If it hurts, stop doing it. So if you're using something over and over, your brain, trying to concentrate on video games, on the computer, at work, trying to make a lot of decisions, make a lot of family decisions, you really have to scale that back, give your brain time to heal and to adjust. And it just takes time for your body to repair itself. So the highest risk groups are elderly patients. By the way, I just got my AARP card in. I'm not sure what that's about yet, but again, people on blood thinners. In the emergency room, we see a lot of people that are intoxicated. They a lot of times cannot give you a good history or what happened. They can, their bodies are much more limber. They have no reaction time. And having said that, they're like, well, they didn't hurt their arms or legs, no broken bones. Yeah, because their head took the brunt of the fall, falling downstairs. So we pay attention to this person's intoxicated. That checks a box for us that we have to dive into this a little bit further, and we have to make sure that this person does not have a head injury. And the confusion, not tracking completely, and some of the physical signs are quite frankly just put off because they've been drinking, and the alcohol is convoluted or covered up those symptoms. Other ones are people with other previous head injuries are prone to get further head injuries, and it just makes sense because if they've had a serious enough injury, there's something with the brain. The term is escaping me, and these guys might know more than me, but there is a term that your brain, I have 6 guys in my practice that have come to me over the years. They all have CTE. All but one has gotten it from high school football, college football, and one player played 2 years professionally. And they've all, the youngest gentleman I have is 28 years old that has significant cognitive decline because he'll tell you he never had that big concussion. We send him everywhere, send him to Mayo Clinic, and he finally got diagnosed with CTE. It is the multiple contusions, concussions, all have a cumulative effect. And he's unfortunately, has small children, and we've all seen like Muhammad Ali as he's gotten older, and other professionals that are in professions that took repeated blows to the head lead to dementia, Parkinson's type syndrome, movement disorders, all can come from repeated concussions and insults to the brain. And the other one that's a high risk group are kids under age probably 16 that jump off of things they shouldn't jump off of. And so they underestimate how usually kids will injure themselves if they jump or fall higher than 5 feet. And so any one of those who've had Spider-Man, Supermans in their life that jump off higher than 5 feet or so can get injured. And we do see that in the emergency room. We had a young gentleman with a cape on last year that jumped off at 9 feet and sustained a head injury. Jumped out of the window of his house and he was convinced he could fly. So he's got a good imagination, but can lead to some serious injuries. So those are the people at higher risk. So the big ones, they'll go into brain rest and those kind of, activities, and what you can do for therapies. The other thing I want to impress upon people is what are those signs that you need to seek professional help? Some people don't fully understand, when should I come see the doctor? When should I come to the emergency room to get checked out? The biggest one is loss of consciousness. That is the number one sign. If you have loss of consciousness, that's the first question we always ask. Did they get knocked out? That means a lot, because that means it was the mechanism of injury and the force was enough to disrupt the electrical input that your brain decided to shut down for a little bit to help repair itself. That is a big warning sign. That person needs a full workup, scans. It's a non-negotiable symptom, though we will insist that you get checked out thoroughly. After you hurt, let's say you hit your head and you don't feel well, it's always, a lot of people do know this, it's repeated vomiting. So there are a center in your brain that if you get hit hard enough, it can trigger vomiting. And those are a sign that the injury didn't knock you out unconscious. But if you have vomiting after you hit your head, it's always good to come in and get checked out. Any significant injury, let's say you didn't feel like you hit it that hard, you have any other secondary symptoms like headache, blurred vision, change of vision, even if it was transient or short duration, should always be come and get checked out. Of course, anyone on blood thinners that hit your head, always play it safe, come in, get checked out. Very important. Confusion is another symptom. And then short-term memory loss. People that hit their head, they got a little dizzy, they sat down, rest, and like, no, I'm fine. And then they're like, well, what happened? Those people have to be checked over. Just as if they were knocked out, there was enough of an injury to the brain that would create you to lose short-term memory or lose thoughts for that day, or confusion, needs to come in the emergency room and get checked out. Slurred speech, anyone who stands to reason, hit their head and then were fine and then felt like they passed out an hour later, they should come in and get checked out. And then lastly, I was going to just talk about how in the brain, being in an organ, being in a protective covering, if you will, the skull. There's really 4 types of injuries. There's, depending on where, you can just have the brain gets bruised. That's a contusion. It just gets hit hard enough against the skull itself, is an injury. That's what we call a concussion. But there's other types of bleeding in the brain, depending on where it's at in the brain. We all have these small blood vessels in between the lining of the brain and the skull, and you can get bleeding in the cover, and that's called the subdural hematoma. And that just, you can about imagine if there's blood that collects in an area, it just creates pressure. It's a confined space, so that blood can collect. We do see our fair share of subdural hematomas, some that can be watched. They're self-limiting, but they have to be watched, and they have to have serial CAT scans and make sure there's no degradation of our mental status, or that we measure those serially with CAT scans to make sure that that's not growing. But some of them have to be relieved because it's a confined space. A hole has to be made in the skull, and then we have to remove the blood and stop the bleeding. Then there's what they call subdural. It's in the next lining below, and same thing. It creates a lot of pressure. And then they have what's called a subarachnoid hemorrhage, and that's bleeding with inside the brain. And those are all surgical emergencies. Very rarely, they can be so devastating, create so much intracranial pressure, so much pressure in the brain that it's very life-threatening. And so we have an agreement with the University of Nebraska. Very little questions asked. We have something like that. We have, the direct bat line right to the ER, and we get the neurosurgeon directly. It's, brain is time also. So any injury to the brain here at CCMH, no time wasted. We get the scan, and then from there, people are airlifted to University of Nebraska right away. There's no, oh, we're full or we can't. There's a few conditions, even in these times post-COVID, where we have taking care of sicker people here. That is the one emergency that, time is everything. And so we have a direct line to them, an agreement that they take all of those type of injuries right now. So, all right, that's all I got.
I'm up next. Right. So I'm Tammy. I'm the speech therapist, and I'm going to follow him up with what happens after you got the diagnosis of concussion and what does recovery look like. This works. Technical. Ready? This is going to cause a problem. Not working. It's not working. Too long. There we go. Working now. Okay. So I know some of my slides are busy. If you want any particular one, we certainly can print it off. But basically the little emblem up there shows the brain hitting there and getting your altered brain function. There's a list of common symptoms that he already went over, like headache, amnesia, irritability, he didn't talk about, but being just change in mood and behavior can be a sign. Insomnia, not being able to sleep versus too much, can also be a sign. Those common symptoms can be immediate, but they're also what you want to watch as you recover, because the number one rule is in that first day to 3 days, you want to give your brain as much rest as possible. Think about if you have a sprained ankle, you obviously always tell you to elevate it and ice it, right? And stay off of it for those first couple of days. Alternate the ice and the heat, things like that. So you want to rest things that are injured. And how do you rest your brain? You have to not be doing a lot of your normal activities. You're thinking and you're watching TV and a lot of stimulation from lights and noise and things like that. So you want to watch your symptoms to help you guide how much rest your brain needs and how long your brain needs that rest. If you go on beyond those 2 or 3 days and it doesn't seem to be even any better, you want to go back into your doctor and have them take a look at you again as well. And continue to watch the symptoms that were listed there for the next 2 weeks as you gradually return back to normal. The newer information says completely use your symptoms to guide your activity level. That's why knowing the symptoms are so important, because You don't have to stay in a dark room with no stimulation, not talking to anybody or doing anything for 3 days. That's not mandatory. You want to guide your symptoms to guide how much activity level and how much interaction you have versus using the exact amount of time that these slides talk about. This one talks more about pediatric concussions. And I think what was interesting on this to me was that children actually take longer to recover from head injuries. The younger child takes longer than the older. So if you're in your 20s or 30s, you're actually going to recover much faster than if you're 5, which kind of surprised me, where I always think of those little kids bouncing back, right? But as parents and caregivers and grandparents, we want to be very conscious. They're not self-regulating, you know, they're going to do what they feel good enough doing, and then they won't maybe recognize that it was too much, and now they're sleeping a lot, or their mood is completely different, or they're acting quite different. So you have to do a little bit more, be a little more watchful of those kids after they fall, and know that it's going to take them maybe more than a day or two to bounce back. The best available evidence tells us that it's a gradual return to activity that you want to do. You want to rest and do things. So as you get up and start doing things, you want to be aware, is my headache getting worse? Am I having balance trouble? Am I having vision trouble? Am I feeling a little nauseous? Am I feeling more irritated than normal? So it's balancing rest and activity that is the best thing to heal your brain. Again, I keep coming back to the idea of your sprained ankle. You know, you can stay off of it at first, and you want to move it and see if that increases the pain, right? But you have to get back up and walk, and you have to get back up and do your normal activities. The same thing with your brain. You want to get back to your normal thinking, speaking, interaction activities, but with balancing, noticing your symptoms and resting when those symptoms increase. They used to say no TV, no screens, right? If your concussion symptoms last longer, we're all pretty tied into our screens, our TVs, our phones, our computers. So again, it's that balance. It's not that you can't be on it. It's you want to be aware of when you start to feel tired. If you have some symptoms that increase, you want to rest at that point and gradually return to using those things. It says, as a gradual return to activities, as long as it does not make things worse, is the best approach. And communicating with those around you, your family members, any healthcare providers, your employers, your school staff, communicate with them what's going on with you. It's always better to have that open line of communication with your employer or with your teacher, things like that.
Is all clear.
And even your spouse, you know, so they know what's going on.
All clear. The emergency alert is all clear.
Additional things to consider, like he said, multiple concussions causes more issues and more long-term issues than single concussions. If you're in the middle of a really stressful situation that you can't get yourself out of while you're recovering from a concussion, your recovery is going to be longer. Or if you have other health conditions, anxiety, depression, post-traumatic stress, chronic pain, any number of health issues, your concussion symptoms may persist longer. Other risk factors that delay your recovery from concussion: prior history of concussion, motion sickness, which I thought that was interesting. If you're a person who's prone to motion sickness, you may have a longer recovery time. Visual problems, learning disabilities, history of migraines. Females, we're so lucky. We always have more complex issues. we could take longer than males to recover. And age, that's where younger children will take longer to recover than older children and adolescents. So the 0 to 10, there it says, will take longer than anybody over 10. So understanding your own personal risk factors so you can take those into consideration is important. Key strategies to recovery is that initial rest period of 2 to 3 days, gradual resumption of activities, understanding concussion and communicating that with those around you. And then if the symptoms persist past a couple weeks, 2-3 weeks, you really should be further tested. Talk to your doctor about further rehab possibilities, because concussions can affect all of the things in the colored brain there. You know, sleep is a big one. If your sleep continues to be disrupted, you should talk to your doctor about that. Or you sleep a lot, but you never feel rested. That sensitivity to noise and lights, you really can't be in crowds. You know, it's been 4 or 5 weeks and you still can't be around a lot of activity or crowds. You're just more emotional than normal, or your word finding, and you just can't find those words to express yourself. Any of those things listed there, you may need further rehab rather than just rest and gradual return to activity. The good news is that if you get the early identification, you know about concussion recovery, and you manage your symptoms, you can prevent any long-term difficulties or disabilities. I think that's the biggest thing we've learned with children's concussions or sport concussions, right? You can't just get up and get back in there. You really do need your brain to be fully recovered before you return back to that sport, or even school. You know, we push our kids back to school so fast because it's hard to know, right? Are they just trying to get out of school by telling us they still have these symptoms? Or do they really need to? And work, we're all rushing back to work because we can't financially afford not to be at work, right? So that communication to the employers and things like that. So don't rush getting back to your normal activities. Let your brain heal. They're up to 3.8 million concussions per year. More than the entire population of Chicago. As many as 19% of athletes who participate in contact sports will experience a concussion. That's 1 in 5. And I don't know what the statistic is on multiple concussions, but it's a feeling it's pretty high. And those are reported concussions. Those are not the ones where they never told anybody they're having any symptoms. So how does speech therapy, what does speech therapy do? If you come to a speech therapist after a concussion, we work on attention, memory, problem solving, language. Executive function are those things that allow you to be a person who runs your own finances, drives your own car, is employed, runs a family. It's any of those things that allows you to function in life that involves your thinking skills. So we would work on identifying which of those things are still impaired and causing you problems. We'd talk about what is it you're having trouble with and identify what exactly your goals are. And then we would tailor that recovery in the brain to match what we see is that you see as a problem and what my testing shows too. And talk about things that fit into your lifestyle that allow your brain to recover. It also is education. A lot of it is education on, this is normal, or maybe it's not. You probably should go back to your doctor, or what that recovery path looks like, how much, if there's anything that may be persisting and what may be helping it, making it persist longer. Social skills come into play here too. So again, if you just can't quite control either you get angry more easily, or you're irritated more easily, or any personality changes too, we can discuss why that might be happening. So I stumbled across this when I was trying to put together my PowerPoint. I thought it was interesting. In Dublin, Ireland, they had these college students put together some slides as a scenario of a college student, but I think this really would also go for anybody, because it kind of highlights the stages of recovery and the feelings about it. So in those first 48 hours, you might feel dizzy, you might have pain in different parts of your brain. The lights may be too bright and hurt your eyes. So knowing that the best way to take care of yourself is to rest your brain as much as possible, but that doesn't mean you have to stay in a dark room until your symptoms are gone. That's a myth. But you do need to communicate to your loved ones, your work, or your school that I had a concussion and I'm going to need a few days to recover. So being responsible and letting the people in your life know. You're going to get physical and cognitive rest for anywhere from 2 to 3 days is usually what they say. And that may be asking for help. At the bottom, it talks there about in college, it may be asking your friends to help bring you food, but at home, it's letting your spouse know, I need these couple of days and you might have to help me a little more. Or at work, I'm going to have to be out for a couple of days. So then you got the subacute phase, which can last about anywhere from 3 days to 7 days. And you're going to start to return back to your normal activities. So you're going to get up and you're going to walk and see how that makes you feel. You're going to get up and maybe try to make dinner, see how that makes you feel. Watch a show with your loved ones, check your emails, do any of those normal things, see friends, take a phone call, take those longer phone calls or in-person visits and see how that makes you feel. It talks about progressing from an hour to 2 hours at a time of using your brain and then giving yourself that permission to rest when you feel any symptoms start to return, rather than push through. It's just a little headache, I'm just going to keep going. In this stage, you shouldn't push yourself to keep going, but listen to your body. So it talks about how can you do that as you're going to school or going to work. Again, a lot of it's about asking for accommodations from your employer, or again, accepting that help while you're still slowly coming back and educating those around you. I'm still recovering. I know I may look normal at times, but I still need more rest than I did before for a little bit to let my brain completely heal. That recovery can continue beyond a week. So you start to get a little wanting to get back to your normal life after a week, right? I'm feeling better. I'm just going to go fully back. And there's recommending, again, be a little careful with that and watch your symptoms. I know you may be feeling like you're falling behind or not getting things done, but you're still maybe feeling more fatigued, like things are harder to think through. And that's should be becoming less and less as the days go on. And if not, you should see your doctor or look at having it looked at. And recovered is when you're fully back to your normal activities without any symptoms at all. But there may be, if there are any symptoms at this point, you definitely should talk to somebody depending on what those symptoms are at the end of those 4 weeks or so. I think that leaves you. Thank you.
All right. Hi, everyone. I'm Sarah. I'm the athletic trainer at the high school. So I spend a lot of my day talking to high schoolers. So this is a nice change of pace. I'm happy about this. Basically, I'm going to go over kind of how we deal with concussions at the high school, particularly in athletes, mainly that 14 to 18 age range. That's usually the people that I'm seeing. And as an athletic trainer, a lot of our, 3 of our domains that we really focus on is that prevention of injury, evaluating those injuries after they happen, and how we can get them back to return to play, return to learn, and returning to their activities of daily living. So that's kind of a lot what I'm going to talk about today. All right, so starting with prevention, there's really not any way that we can necessarily prevent a concussion 100% from happening. When you're playing a contact sport, it's going to happen every now and then to athletes. So instead of preventing the act of a concussion, what we really primarily focus on is preventing those concussions from happening over and over again and focusing on how can we identify them when they are happening. So we use an app called Sway Medical. So in that handout that I gave you, this kind of talks about what Sway Medical is. Basically what it is an app that we use, and we do baseline testing prior to each sports season using this app. So each of the athletes that are participating in that sport, mainly our contact sports. So we do football, volleyball, basketball, wrestling, soccer, baseball, and softball are our athletes that will be baseline tested, because those are going to be more of our high risk sports. They take a test at the beginning of the season, just to see where their normal is, to see what their baseline is. And in that, they are going to mark down their symptoms. So what are normal symptoms for them? Do they experience headaches? If they do, they need to mark down that they experience them and their severity. So that way we can differentiate, is this worse than your normal, or are these symptoms new if a concussion would happen? They also test with balance, inspection time, reaction time, impulse control, and memory. So the nice thing about this is this gets their baseline, and it's kind of like fun games that they play. It's not just like checking boxes and answering questions. Each one of these has like a fun little game that the underlying goal of it is to test these things, but the students don't feel like they're just checking boxes. They're just playing games on their phones. So that is really helpful. And because it is mobile and accessed on our athletes' phones, which they all have and all have on them at all times, it is ideal for our like sideline clinic and any remote assessments. So they can do it from home as long as I give them the permission to go through it. A lot of times with baseline testing, I have them do it with me. So I make sure that they're doing it correctly and not cheating or doing things wrong. So that way we have that good baseline measure. So it is each year we will have our freshmen and juniors be tested, and then those baselines will be updated every 2 years. This year, since it was the first year, we have everybody doing it. Next year, we will just do our juniors and our incoming freshmen, and then that baseline will be good for those 2 years. We do update it in between just so we have kind of an updated look as these students grow as well. Athletes do not need to retest prior to each sport. Once they have it done and a baseline for that year, it will work for all sports. So if I have an athlete that's playing volleyball and soccer, as long as they take it prior to volleyball season, they do not need to take it again before soccer season. So that is helpful as well. And then looking into the initial steps of evaluation. If I suspect or someone suspects that our athlete has a concussion and they come up to me, say during practice, and they're like, hey, I have a headache. I'm feeling a little dizzy and kind of feeling a little nauseous. A lot of times we will have that conversation on what are you experiencing? How are you feeling? Things of that nature. Typically especially I see this a lot in football. There could be about 1 million reasons that these kids have headaches or dizziness or things of that nature that necessarily aren't a concussion. It could be dehydration, it could be overheating. I had a kid one time, I asked him how he was feeling, and if he told me he was hot and dizzy and his headache, and I said, okay, how much water have you drank today? And he said, I went to the water fountain 7 times. And I'm like, okay, there could be other things going on. So a lot of times I will take them out just initially, give them about 5-10 minutes of rest. I'll check back in with them. If they're still feeling those symptoms, I'm going to pull them out of activity for that day. A lot of times I do not do the sideline test right that second because there could be a ton of different things contributing to their symptoms. So I will then wait about that 24 to 48 hours following the injury, check up with them. If they're still having issues and they're still not feeling right, then we will do our sway follow-up exam. And that is going to basically be the same thing as the baseline, except they're just doing one trial of each one. So that will look kind of like, then I'll be able to see any symptoms or areas of deficit in those particular spots to really decide where we're at, how they're feeling, what it's looking like, and then be able to diagnose or identify a concussion a little bit easier. Obviously, if we have any of those red flag symptoms, someone gets hit and they lose consciousness on the field, that is obviously an immediate referral, as well as your vomiting, your double vision. Any of those red flag symptoms that Dr. Luft talked about are going to be our immediate referrals. And if we do have a kid that comes up and he's like, hey, I bumped heads with another person, I have a headache, I got dizziness, blurry vision, as long as he isn't presenting with any of these red flag symptoms, a lot of times I will pull them from activity, keep a close eye on them, call parents or their adults, whoever is taking care of them, let them know what happened, let them know of the red flags, and say, if any of these things are happening or you notice any of these things, please take them to the ER. Otherwise, I will check in with them again tomorrow. And that just kind of gives everyone a peace of mind. So that way people are being communicated with and know what to be looking for. So following that 24 to 48 hours following, we will do a reevaluation a lot of times with me. If they did go to the ER, we follow the doctor's orders. Whatever the doctor recommends is what I'm going to do. If the doctor says you are resting for a week, they are resting for a week and they will follow up with that physician. If that person that had a headache and dizziness and blurry vision that I called mom and dad come back the next day and they're like, hey, I feel great. I have no issues. I actually like ate some dinner and I'm great. A lot of times we'll keep a close eye on them, but for the most part, they're okay to go back into activity. If though they're still like, yeah, today school was a little difficult. I'm feeling slowed down. I'm just not feeling right. We will do that follow-up concussion test, note their self-reported symptoms, the results of their, the little things that they test for, and then kind of decide from there. So sometimes the patient might not need to be referred. Maybe they're feeling those normal things that you feel after a concussion that are expected, but they're also not any red flags that I'm like, you need to go to the doctor right now. So they might be held out of activity for that day. They might be scaling back on school a little bit, but we will reevaluate the next day or in the upcoming days. We'll not participate in their practices, but we will check in tomorrow and see how you're doing. Okay. For a referral, if those symptoms continue, or if they come in the next day and they're like, hey, I've been feeling like I'm going to throw up all day, or their test shows that something's really not right, that is when I will call mom or dad and say, hey, we need to get them into their primary care physician or a concussion specialist. Typically, those referrals are made, again, like I said, if any of those red flag symptoms are present. And if the patient continues to report a high symptom score, 60 plus for 3 days, that is outside of their normal. And then obviously parent or patient preference. If a parent is more comfortable going to a doctor, or the patient is more comfortable getting checked out, I will never turn them away. It gives all of us a little bit of a peace of mind, just knowing that everything's okay. Also looking at their deficits on their exams. If there is a significant deficit for 3 or more days, that is another one that I might be like, hey, your reaction time's been really slow and it doesn't seem like it's getting better. Let's get you in to get this checked out so we can get it taken care of now. And you don't get hurt later on in an activity. And then finally, our return to play. So our athlete return to play protocol is provided by the Iowa Girls High School Athletic Union and the Boys Athletic Union as well. This is on that. There's an outline of it on this document also handed out. Okay. They just provided this to us this December. December 1st was our first day that this went into play, and it has been extremely helpful and a nice guided way for us to work on that return to play protocol. So it kind of outlines there. It is a 6-step, 7-day timeline following a sports-related concussion. So if that concussion is suspected, this is what we will do, and we will follow this step by step to get them back into activity safely. So a quote from there: following an initial period of relative rest, approximately that 24 to 48 hours after injury, students can follow a gradual, stepwise, symptom-based return to play protocol under the guidance and supervision of a licensed healthcare care provider, which would be me in that case, which is very helpful because I am on site able to see them all the time. So there is a minimum of 24 hours between each of those steps and a minimum of 7 days to complete that protocol. So a lot of times this is where people might have a little bit of disagreements with it in terms of like the athletes mainly. If they have a concussion that they sustain on that Friday night football game, they will more than likely be out for that next football game as well. That's where it kind of gets a little hairy, but it's nice to have this written down and an Iowa state law that this is how it has to be, so we can make sure that they are staying safe and honest. All right, so then this just kind of outlines what it looks like. So this is our step-by-step process. Basically in those, or looking at that first page anyways, I have to look at and fill out this first page. So I can look at it after I see them after that first day. I can mark down that they are not cleared and they need to follow up with me. If they see that primary care physician, we mark down not cleared. They need to follow up with that physician on X whatever day, okay? Then this next step, after we have that reevaluation or they sit out for that period of time, I can mark down that they are clear to start that step 1, 2A, 2B, and step 3. Those are the only steps that they can start still having symptoms. Obviously, if they're having like a 6 out of 6 headache, I'm not going to make them start that. That's going to be if my headache's a 2, my difficulty concentrating is a 2, those lower symptoms, I can go ahead and get them started. All right, so the step 1 is going to be that 24 to 48 hours after injury, and that's going to be the symptom limited activity. So that might just be looking like, let's just have you slowly walk for 10 minutes and see how you feel. If those symptoms increase, we do have them back down and stop what they're doing for that day and rest. Okay. If they get through that, they're like, I felt great. We move on to step 2A the next day. And those kind of outline there. What does that look like? We might pick up our pace of walking. We might walk for 20 minutes instead of 10. As long as they're continuing to feel okay and not have any increase in symptoms, they are allowed to move on to that next day. So the next day, move on to that 2B, and then day after following that step 3. After that step 3 is when I will follow up again with them. They must be completely back into school with no issues, okay? And to move on to that step 4, I will check back in with them. Obviously, I'm checking in every day, but making sure that they are completely back to their activities of daily living. They aren't having any symptoms. They're feeling great. They're feeling completely back to themselves. Once they feel that way, we will move on to that step 4. So that's going to look like they can move into more of their sport specific things, but doing it on their own. So doing shooting drills by yourself, doing running routes by yourself, things of that nature. As long as that's again okay, they move on to that step 5, which is they are participating in a normal practice. So they are participating contact, full go, let's see how you feel. If again, they feel great, they are cleared to return to that sport on that step 6, okay? Again, like I said, if say we get to step 4 and they had no symptoms coming in, but after doing 20 minutes of practice, they start to have a headache. They will stop for that day. We will try that step 4 again tomorrow and see how it feels. It's kind of just depends on the student, which is where it gets a little tricky because I have 2 types of kids most times, 3. You have your very small amount that are honest and tell you exactly how they're feeling all the time. And they are honest and they will do the right thing and take however long it takes to get back. Then you have those that are going to tell you they feel great no matter what, just so they can move on and get back faster. And you'll have those that will tell you no matter what you do, they're not feeling better and they feel horrible. That is when getting to know these athletes and being with them all day, every day, having these conversations, knowing their personality really benefits me because I can see, hey, you were just messing around with your friends in the hallway acting completely normal and now you're not feeling okay. What's really going on? Are we not wanting to participate? Are we not wanting to practice? Then you can have those deeper conversations. It might be that they just aren't feeling good when they start activity. Then we adjust from there. Same with those athletes that are like, no, I feel great, but they're sitting in the corner not talking when they're usually up acting crazy and having those fun conversations. That's when you have that conversation of, are you really feeling okay? You seemed really slow. You seemed to took like a little bit longer today at practice to figure out what coach was talking about. Things of that nature, or you forgot this play that you've ran 100 times before. What's going on? That's when having an athletic trainer, especially at the school with these kids every day for hours a day, does come in handy. So that's kind of one of the benefits of having it. And it really has come in handy too with making sure like now these kids know that they can't just get away with it or not. They have somebody there to talk to about it and help them with it. So it's been a good experience and it's been really beneficial for the kids and the coaches as well to not have to think about it and have that on the back of their mind when they have a million other things to think about. So yeah, that's kind of how I go over it, but that is all for me. Does anyone have any questions for Tammy? Yes.
So with us older ones, I think we need an athletic trainer too.
Yep, I know I need one.
We could really learn a lot from that. And do you want to go into further detail regarding what CCMH has to offer for speech and getting us back up and going again?
Yes, so you've kind of seen the timeline that you should expect symptoms in those first week or 2, and the issues about what may delay that. Okay, so if you have multiple health injuries, if you've had previous concussions, if you have some of those things that'll delay it, but you should see a gradual improvement. If you don't, then you can go to the doctor and they can refer you then to, we have speech therapy, which I would cover any of the thinking skills, the memory skills, the how do I decide what to do, and what not to do? How do I make those decisions about what I can and can't do? If you're having balance issues, ongoing balance issues or vision issues, our PTs are excellent at helping assessing that vertigo or that balance. I'm just not, I can't walk the way I used to. I can't move in a space the way I used to. If you're having trouble bending over and putting on your shoes or getting dressed, or, you know, you get through a shower and you're just exhausted and your symptoms ramp up, you know, possibly the OT then would help with those cooking. What can I do with the cooking, the bathing, the daily activity things? How can you adjust that until you recover fully? And when you get back to where, you know, most everything is normal, but a few of those things are still persisting. Again, our therapies are available to you to help you navigate that and decide, is this a normal part of my recovery? Or is this really lasting longer, and what can I do to try to maximize that recovery or deal with it if it's going to be here longer than 2 weeks?
Thank you. I also found by coming here too, you guys have given me a lot of confidence that I lost last year. And everybody does work really hard in the therapy department. So.
It's very individualized. You know, we're very much going to, you know, that's why it's hard to talk about what could we possibly do. We tailor it directly to what you need, your goal is, and what trouble you're having.
You've got a lot of energy. I like that.
Thank you. Thank you.
Thank you, ladies, so much. Dr. Luft sent his apologies. He had to get to rounds on the floor, so he was not able to stay and have a Q&A. Do we have any other questions for Sarah or Tammy before we let them go?
I have a question about shaken baby syndrome. Is that just multiple concussions?
You know, Dr. Luft would be the
Yeah.
best answer for that. But you know how he talked about the brains in that container, right? So you're pushing against something hard. So you can have the bruising, you can have the subdural hematomas, you know, the bleeding, it can be the shearing, you know, depending on the severity of the injury, right? So it depends on how severe the shaking is, how long it goes on, if it's repeated. You know, maybe it was just a little bit and then they didn't have full time to recover and it happens again, or they fall. Yes, yeah.
There is like a second impact syndrome in concussions that causes death. People can die and have died from second impact syndrome. So it could be very similar to that. Could be why babies pass away with that situation, is because when your brain has already had that injury and having it over and over again, and that's part of it. Yeah, it doesn't.
Which
get
is
enough
why
time
it's
to
so
heal.
serious
Yes,
for
so
athletes, right?
serious.
Why it's
Yes.
being taken
And
so
why we
seriously
take
now.
all the precautions in
Especially
time.
you hear of like daycare workers
Yes.
going to prison
Right.
for killing babies, for shaken baby. And maybe it wasn't even them.
Mm-hmm.
You know, I'm hearing this could be a constant thing day after day. And when you get to the babysitter, some little thing could trigger it and they die.
Yeah.
Yeah.
Sad, really,
Very,
Right.
very sad.
because you can't prove anymore.
Right.
And then for you, how many students are involved in your,
Oh,
I mean, how many do you?
yeah. I don't have an
Exact
exact number, and it depends on the time of year. So let's say this year football, we had about 50 kids out. Cross country had around probably 30, and volleyball had around 30. So
How
I'm
many
looking-
did you have? See,
yeah, so if there's 110 athletes, I'm probably seeing anywhere from 30 to 40 on a weekly basis, I would say. Yeah. And it kind of depends on the season and the sports too. And it depends on the kids. Some kids are more comfortable and other kids aren't. And it's just kind of how it goes. But yeah, I have a seminar as like their homeroom at the end of the day. And my office is available then. And I get anywhere from about 10 to 20 kids that try and come in. Do all of them need me all the time? No. But I bet I see probably at least 30 kids a day.
So you're part of the athletic department
Yeah.
rather than the nursing department?
Yes. Yep. I primarily take care of the athletes. Yep. Like I had 3 kids that participated in a winter sport that had surgery following their winter season. So right now I'm working with those 3. They had 3 surgeries in 1 week, so it was a busy week. But so right now I'm working a lot with those athletes whose injury primarily occurred in their sport. So yeah.
And you're not just talking concussion?
Nope. Anything and every injury. Yeah. Yep. Yes.
Does every school have one of those? Every high school?
No.
Okay, that's.
It's primarily you'll see it in your bigger high schools, especially in Iowa. A lot of your Des Moines schools will have one. A lot of your like Council Bluffs schools will all have one. But actually it's not very common to find an athletic trainer in Iowa at the size of Denison. That is primarily at the school all the time.
And I would imagine the school pays their salary too.
Yeah.
Bigger
Yes,
cities.
yes. And they could do some outreach from other like PT places as well. It just kind of depends on how everyone has it laid out, but it isn't common to find athletic trainers at a school the size of Denison. That the athletic trainer is only at that school and they are there every single day. That's not common. So it's very exciting. It's good. It's a good thing. It's great for them.
So is your degree athletic trainer or is
Yep.
it physical therapy?
No, athletic training. So I have my bachelor's in athletic training, and then my master's degree in advanced athletic training is technically.
Sarah, how long have you been doing that?
I've been certified since 2021, so almost 5 years. Almost 5 years. Yes, 5 years in April next month. Yeah. So yeah, this is my first year at Denison, but other than that, I've been certified for 5 years. So yeah.
Great.
Okay. Well, if this was your first lunch and learn with us, thank you so much for coming. If you're a repeat, thank you for coming back. Our next lunch and learn, we do these monthly. The next one will be April 21st. The topic is stress awareness. We're actually going to be moving off-site. We're trying to take it to the library. So it's going to be 4 p.m. at the New Orleans Community Library on the 21st. Kelly G from Senior Life Solutions down the hill will be presenting. So again, they're all free, open to the public. If you'd like to attend, please just give us a call or you can go online to register. And then I did want to extend the offer. Our clinic is now open. The doors are open. If you have not had the chance to go over and see the new clinic, but you would like to see it, you're welcome to stick around after the session ends here, and I'd be happy to take you down. I will warn you, it's a bit of a walk, but we can go down and check out the new space. So thank you so much, ladies.
Thank you.
Yeah, thank you all for coming.